Welcome back to Sandra Sells Tells. Real estate, real people, real Plymouth. Whether you're driving, walking the dog, folding laundry, or sneaking in a little me time, I'm glad you're here. Let's dive in. Today's episode is all about something that impacts every one of us, whether you realize it or not. How we move, how we feel in our bodies, and how that affects our ability to stay in our homes longer. I'm joined by Ashley Katzenback of Cape Concierge Physical Therapy, who takes a unique approach by bringing physical therapy directly into your home. We're talking about mobility, fall prevention, strength, and simple changes that you can make today to stay safe, independent, and confident in your everyday life. But let's be honest, it's not just about loving your home. It's about being able to live in it comfortably. So welcome, Ashley.
Thank you, Sandra. I am so excited to be here. I feel like I could listen to you talk all day. Your voice is made for this. And I have been, speaking of driving around to people's homes in my little Prius, I have been listening to your podcast and loving it.
I love it. I love it. I love it. And thank you for saying that.
You're welcome.
Everybody else, listen to her and
Yes.
listen to me while you're driving.
There's a lot to learn.
Or walking the dog, because I have good people on here like you.
do.
And
You
then we
do.
can learn so much more.
Yes.
And that's kind of why I wanted you on here, because I met you at a networking group that we're part of, and you did a presentation, and I had no idea all that you guys offered. And I was just like, wow, I got to spread the word. So I'm excited to have you here. Let's talk about what is concierge physical therapy and how is it different from traditional PT?
Yeah. I think concierge gets thrown around a lot, but in my world, concierge means what you want, when you want it, right? So what is it that you need? When do you need it? And where do you need it? So, for example, you are stuck at home. You are dizzy because you woke up and the room is spinning and I can't leave my house because I can't get in my car and I need help. So we can come in, help you evaluate why the room is spinning, treat this likely vestibular condition, and help you get out the door and so you can do your errands.
Very good. I like it. And because there's probably so much to dissect there if the room is spinning and waking up. It could be so many different things.
Exactly. We have to figure out the why first.
Okay. All right. I like it. And so that probably means that it's not just physical therapy that you guys are providing. Am I right to assume that?
You're right. So
tell me some other things then. Tell me.
So we really believe in just treating the whole person. So whatever your symptoms might be, you would call us or email us or fill out our contact form on our website, and we're going to talk with you and figure out what is going on and who is the best person to come and help you, whether it's a physical therapist, an occupational therapist, a pelvic health therapist, a speech therapist, a strength and conditioning coach, a menopause coach. What is it that you need?
You have a lot of options there. It's not just coming here doing PT and do your little leg or arm exercises.
Right. And PT can mean anything. Maybe you need a vestibular therapist that's within physical therapy, or maybe you need a neurological therapist because you've had a stroke or you have ALS or your Parkinson's is progressing. Or maybe you're in menopause and this musculoskeletal syndrome of frozen shoulder and hip bursitis and plantar fasciitis, and you feel like your whole body's falling apart.
Golly, I need to have you in my house. Holy cow. I'm taking notes here.
Or maybe you're a teen athlete and you just keep having all these overuse injuries because you play a sport 7 days a week and you need to build your strength and coordination. So it's not as simple as I went to my primary care because I had knee pain, who then sent me to the orthopedic, and I had an x-ray, and then I went to physical therapy for 6 weeks, but they only treated my knee pain. And then I had an MRI to come to find out it wasn't my knee to begin with, it was actually my hip.
Oh my gosh.
So
you guys can kind of break that down.
Yes, we're going to spend some time with you and look at your entire body and figure out where this is really coming from.
Okay. What if you notice that somebody might need an x-ray. Is that something you guys do, or do you send them out for that?
Yes. In Massachusetts, some states, physical therapists can order an x-ray. Massachusetts is not one of those states. So we have learned language over the years, and depending on the situation, we might have someone go to urgent care and get an x-ray.
Okay.
Or we have great relationships with a lot of primary cares and orthopedics in the area. So we might suggest they see a specific doctor and have an x-ray there. So it's just about knowing, like, what body part do you need further examination on? And also knowing sometimes it's more affordable to go outside of your insurance. Maybe you really do need an MRI, and maybe we can send you somewhere and you can have a cash MRI, a cash pay MRI, and it's going to be more affordable than actually using your insurance, and you don't have to wait as long.
Oh, okay.
So it's just...
So you know where they can get that, or they can do that, and
Yes.
how to address the issue to figure out where the issue really is.
Right.
I like this.
Yeah, so
All
just
right.
the ins and outs, but we have more time. That's the beauty. So maybe that's really what concierge is. Maybe concierge means having time.
You're not rushing them.
Right.
Right? Like at any physical therapy. They're trying to get through however many a day, and right?
Yep.
But you don't have to do that.
We don't have to do that. We have I always think that the greatest skill that we have is the ability to listen. Because if you do listen long enough, the patient will tell you exactly what's wrong with them and exactly where it's coming from if you just listen long enough. They know.
That could be said in so many situations. But yes, especially when you're trying to get to the pain point.
Yes.
I'm assuming most of your things are probably people's balance or strength is declining. Like, what are some of the warning signs that that's starting to happen?
Yes. So I think the easiest thing is that you start walking slower.
Okay.
So people
That's a warning sign?
It's a warning sign.
Okay.
You will start walking slower. You will start taking longer to get up from a chair. You will not want to get down on the floor because you know you have to get back up from it.
Mm-hmm.
Those are typically the first signs that things are becoming stiffer, and therefore you're less likely to move,
Okay.
and it becomes a vicious cycle.
All right. Good. And falls are a huge concern, obviously. What are the most common causes that you see?
Falls, honestly, rushing to the bathroom.
Okay.
So, which brings up a whole nother concern, bladder health, which we treat a lot of.
Okay.
People in the middle of the night are getting up to use the bathroom frequently because of bladder control, or they are rushing in the door quickly because they've been out running errands and they feel like their bladder, they have to go. They're going to burst, and they're rushing to the bathroom and they trip over something.
Oh, boy.
So that's very common. But that is preventable because we can retrain your bladder, which is one of the things that's very common in our practice is pelvic health.
Okay.
And
good to know. Most people don't know about pelvic health.
It is not.
And it is a thing that you can learn and train and.
Yes, it is not normal to have bladder urgency leakage. It's common, but it is not normal. And the bladder, just like any other muscle in your body, can be retrained and can get stronger no matter your age, no matter your condition.
Is that from doing Kegels?
It can be. It can
or
be
is it
Kegels.
something completely different?
Well, it could be Kegels, or if your pelvic floor is weak, it could be Kegels,
Okay.
or it could be that it's very tight and it could need lengthening.
Oh, there's so much I don't know.
Yeah.
Okay, this is gonna have to be another topic for another day. But
so that's
okay.
So that's false, right? So it could be just rushing to answer the phone.
Yep.
Turning quickly, tripping over the dishwasher. Please, for the love of Pete, when the dishwasher is not in use, close it. Close the dishwasher.
Yeah.
Do not stand on a stool to reach the top cabinet. It's fine. It's fine. Just leave it there. Put things on lower cabinets.
Yep. Yep.
There's no need for that.
Absolutely. So that's probably you're jumping ahead.
I know,
to me.
sorry.
No, I love it because my next question is like, what are 2 to 3 simple things that people can do right now to reduce a fall risk? And the lower shelf for your dishes is one.
Yes.
Give me a couple other.
Get rid of your scatter rugs.
Mm.
Yep. I know we love them. I know they're beautiful.
I have them for my dog because my grand dog, because she's afraid of the hardwood floors.
That's true. That's true. But if you notice that your balance isn't wonderful, we often trip over the scatter rugs.
Okay.
Make sure there's really good lighting in your stairwells. Right?
Okay. Yep.
Tripping downstairs is common because it's our vision as we age oftentimes declines. And looking downstairs or upstairs where there's both a change in dimension. If the lighting is not bright enough, it's going to be harder to see that, and we can often miss the bottom stair.
All right. I'm big on having a light on when I go up and down stairs.
Yes.
Like all the time.
Yes.
Whether I need it or not.
Yes.
And I have night lights on all
Yes.
stairwells.
Well, that's a great idea. Night lights, great idea.
Yeah.
There's so many automatic sensors now.
Yep. There's this condo that I bought like 7 years ago. There was this giant light at the bottom of the stairs above the closet. I'm like, what the heck is this thing? And it's a motion sensor for at night. I'm like, this is like great.
Yeah.
I love it. The lady was smart.
There's motion sensors in toilets now.
Yes.
That's pretty cool because, again, getting up at night to use the bathroom. So leave the light on in the bathroom at night, right? Yes, you may see that light and it may disrupt your sleep. So wear an eye mask.
Yeah, right.
Wear an eye mask.
Yeah.
Leave the bathroom light on so that way you're not disoriented when you're walking to the bathroom at night.
So many people are. So that is great. Is that probably in the home, what are the most danger zones that people don't realize? Probably the bathroom.
The bathroom.
Yeah.
Grab bars. So slipping and falling in the shower, getting in and out of the shower.
Yep.
You're wet.
Are there other areas in the home that are more dangerous than others?
Stairs, shower, coming into your house with 2 arms full of groceries.
When we're trying to carry every bag in at once. Jeez, I feel like you're talking to me today.
Well, I agree. We can only we must do it all in one trip. I agree with you. But those are common areas for...
You'll fall.
You will fall, right? Yeah. So tripping.
And I've done that tripping up the stairs too.
Yes.
Okay. So is there some small, affordable updates that make a big difference for somebody who's aging, say?
Yes, absolutely.
To help with the fall risk? Like what would you suggest?
So what do we call the outer door of a house? So not the steel door, but the storm door.
Yep.
So what is it called when you have the storm door and you open it and it stays open? What is that called?
Oh, the thing that holds it open?
Yes.
Yes, I know what you're talking about. I don't know the name of it, but...
That thing.
Yeah.
If we could put that thing on there.
That'd be great.
So it holds open. That would be great.
Okay.
So you're not worried about the door hitting you as you walk in the house.
Just kind of lock it, keep it shut, keep it open. Yes.
That would be wonderful because oftentimes we're rushing so the door doesn't hit us in the back of the leg. That's one.
Okay.
A grab bar or a handle by the threshold of the doorway.
Okay.
So because oftentimes we don't have a railing going into our house. We have or from the garage into the house. We've got a step or two from either the garage into the house or from the front door into the house, but typically no railing.
Okay.
So a grab bar is wonderful.
Right there by the door. I've seen that on many homes that I have sold for older people, and they are great. I use them when I'm there. I don't have one at mine, but I think about it every time I see one. I'm like, oh, I love this.
It's really simple. It doesn't really stick out.
No.
And it makes a big difference.
We all could use extra support.
Yeah. So I think those 2 things would make it easier getting in and out of your house. And if it's easier to get in and out of your house, you're more likely to do so, which means you're more likely to move.
Yep.
Which means you're more likely to get outside, which means you're less likely to be depressed. You're more likely to move. You're more likely to connect socially.
Very true.
So
Very
it's just
true.
simple things that can lead to a better quality of life and let you stay at home longer.
Which is the goal for all of us.
Yes.
So what are a few simple exercises people can do at home to maintain strength and balance?
Okay, get up and down from the floor.
Okay.
Get up and down from the floor. From the floor.
Oh, okay.
Yep, we got to do it. We have to get real comfortable with the floor.
Okay.
The thing that scares us the most, we have to do the most often, right? The floor is scary. No one wants to get down there. But if we do it, we become confident. Get up and down from the ground.
Every day?
Every
Practice?
day. Every single day, we have to get up and down from the ground.
Okay.
That is step number 1.
So every day somebody should be working on their strength and mobility.
Get up and down. You will use all of your muscles and all of your body parts at once by getting up and down from the ground.
Now, it's hard to do this without them seeing us. Is there a way to do that? Does it matter how they get up and down from the ground? Some
Nope.
people turn on their knees and go up that way. Some just can pop right up.
Nope. Whatever way works for you.
Okay.
Any way is fine.
All right. So that's one thing. Get up and down from the floor every day, she said.
Every day.
Okay. What is something else?
Get up and down from a chair.
Okay.
Every day.
Okay.
Every day. And climb a flight of stairs. Every day.
All right. That's funny you say that. I bought a townhouse specifically to continue to do the stairs. And even if my knees hurt, I'm like, it's okay. It's okay. It's okay.
Do it. Your knees will hurt less because motion is lotion. The more you move your joints, even if it hurts, the better they will feel.
Okay. So here's a random question to ask you that my oldest son, he's 36 and he's very fit and very active and very involved in, like those outdoor races, Spartan races, things like that. So he always goes down the stairs backwards to help with his balance and his strength. And he's told me to do that too. And actually, honestly, when I have high heels on and I'm going downstairs, I do go down backwards and I do have to hold on to the railing. Yeah. But how does that help?
So walking backwards downstairs is probably the most challenging version, but walking backwards in general is the most challenging thing you can do for your balance. Okay. Typically when people fall, they fall backwards, right? So training your balance just by walking backwards, you're going to improve it. So oftentimes I'll ask people to walk backwards in their kitchen, start by holding on to the counter and practice walking backwards, right? Whatever you practice, you will train. You'll become better at it. So
glad I asked you this question. So I'll see him do that too when he's home visiting. I walk every morning. He'll go with us and he'll just start walking backwards too. So
yeah, I mean, I wouldn't recommend walking downstairs backwards in high heels. I think that's a recipe for disaster. But maybe take the heels off and then walk down backwards. Just we want you to be around to do another podcast.
It's when I'm headed out the door. But I will do that. Okay. I will take them off and put them on at the door.
Okay, great.
Okay. But I've also noticed that my knees don't hurt as bad when I go down backwards.
And it's because you're putting the weight on the ball of your foot instead of your heel, right? If we load the weight onto the ball of our foot instead of our heel, we're putting less pressure on the front of our knee.
Oh, another great tip.
So many tips.
So if I'm going up the stairs, this is all about me right now.
Yep, let's do it.
If I'm going up the stairs and my knees are hurting, I need to go up more, push on the front of my foot, not the back.
Yep.
And so my problem is I'm using the back and not realizing it. Oh, okay. This is this is good stuff.
You got it.
It kind of goes into my next little, I was going to start asking about like injury and recovery. There's a lot of preventable injuries and one is going downstairs in high heels, which is hard. But what else are some preventable injuries?
Well, if we're specifically talking about aging in general, you have to move. Not that I'm the world's best flosser of my teeth, but use the muscles you want to keep, right? So the dentist says floss the teeth you want to keep, something like that.
Yeah.
Use the muscles you want to keep. Okay. So if we don't use those muscles daily, like getting up and down from the ground, like climbing stairs, like getting up and down from a chair, they won't be available to you when you need them. You have to use them every day. Walking is the most fundamental, essential exercise that needs to be done daily. There's nothing better you can do for your body as a whole than walking.
Woohoo, I'm ahead of the game. I've been doing that for years.
So listen to this podcast while you're walking, but keep walking. Walk outdoors, great for your mental health as well. Great for you to sleep. And speaking of recovery, sleep is the best thing we can possibly do for our bodies to recover.
Sleep. All right. Sleep. Get outside and walk and sleep.
And then preventable injuries are going to be our joint stiffness, our loss of muscle mass, and our loss of bone density, right? Yeah. So all of those things, at a certain point in our lives, we can't prevent them, but we can reverse them. We can gain bone density, we can gain muscle mass, and we can improve joint mobility. So if you already have some of those things at this point in your life, we can't prevent them.
Right.
We would have had to prevent them in your 30s and 40s. So if you're 30 and 40, you can prevent them now. Pick up some heavy weights. But if you're past that time and you have loss of muscle mass, loss of bone density, you can still change that. It is not too late. You can still reverse those things.
Good to know. Good tips. Good tips. So you heard her. If you are on the younger side, pick up those weights. I have some extra ones at home I'm trying to get rid of. So you reach out to me. I'll be happy to give them to you for free. They come from a good home with high hopes of really using them. So, and keep moving. I say that every day above ground's a good day, right?
Yes.
But keep moving. What do you think? This is probably a common sense question, but what is the biggest mistake people make recovering from an injury?
Oh my gosh, that is a tough one.
Oh, I thought you were going to say it was easy.
No.
Hey, they used it too soon or something like that, right?
No, recovering from an injury. I think probably not doing enough. I mean, some people say, well, it hurt, so I didn't do it.
That's true.
But sometimes you've got to push through a little bit of discomfort.
Right.
Sometimes you got to push through a little bit of pain. Sometimes you're not going to get better if you don't push through a little bit of that.
You got to avoid it.
So we have to get back, I guess, in order of importance in recovery. You have to get back full range of motion first. Then you have to get back your full strength. If both of those things have happened and you still have pain, you got to push through that pain.
I agree with that. And Mom, if you're listening, I'm sorry, but she's always saying she's in pain and she can't move and get around. And I'm like, if you would just walk to the mailbox every day, that would be a good start. And that is exactly what you're saying. Yes, it's painful, but it's more painful the more you sit and don't get up and get going. So get up and down and do that.
Well, one of those fundamental questions, why do you have pain because something is injured, or are you injured because you're in pain and you're not moving? And more than likely, you're in pain because you're not moving.
All right. Say that again. You are in pain because you are not moving. So if you want to try to get pain-free, I mean, there's some things that some people are going to have pain no matter what. We understand that.
Yes.
But in general, all of us just keep frickin' moving.
Yes. We can get really scientific here, but in our fascia, there's these things called nociceptors and mechanoreceptors, and that's where our pain sensors live. And if we move our body, if we move our fascia, if we move our tissue, then all of those pain receptors move too, and they're not so thick and dense, and you feel better.
I love it.
Okay, Mom, you heard it.
That's right. She said it. Not just your daughter. So we kind of talked about this in the beginning, but I know that there's a huge advantage to having you guys come in the home, right? Kind of touched on that. What do you see? How do you see seeing someone in their actual living space change your approach?
Yeah. In the simplest of terms, you can fix it faster.
Okay.
You can come in and you can see what's wrong pretty much right away. If the situation is that you're sitting in your recliner incorrectly, if you're sleeping with too many pillows, if you're leaning only to one direction when you're peeling potatoes, whatever the situation is, we can look at it right then and there, and we can correct it right then and there. Pro tip, get rid of your recliner. And pro tip, you probably have too many pillows. But again, we can see all those things immediately, and we can correct it right there in the moment.
I like it. So you say get rid of the recliner. What's the best place for them to sit to watch their shows that they watch all day?
In the firmest chair possible.
In the firmest chair possible.
Yes.
Okay. Very good. And so we are blessed to have a ton of walking trails all around us, the coast, the beach, all of that. I love walking all of them. Are those something you recommend if you can do it safely?
Get outside. Get outside.
Okay.
Get walking. If you struggle a little bit with balance, walking poles are great. Go with a buddy. There's great different walking groups out there.
I have noticed that, and I've seen them too, like groups of them and the walking poles. Like, don't feel like I don't need that.
Yes.
Because I think it's super helpful as an extra balance.
Right. If whatever enables you to do the most challenging thing, do that thing.
Okay.
Right?
Challenge yourself and do it.
Yes.
I love it. I
Yes.
love it. I love it. Okay. So if someone wants to stay in their home as long as possible, what's one thing they should start doing today?
Getting up and down from the ground.
Up and down from the ground. She said that more than once today. So I want all of you, when you are done listening to this podcast, go sit on the ground and get yourself up. Even if it takes a long time, at least do it once, and every day add one more time.
Well, because the thing that is going to take you out of your home and put you in a nursing home or a skilled assisted living facility where you need help is the inability to get yourself up and down from the ground, right? You've fallen and you can no longer get yourself up, or you're dependent on your loved one to get you up, and then they get injured.
True.
That is why you're going to end up leaving your home, or you are no longer in control of your bladder. That's also, you're going to end up in a skilled nursing facility.
And that's also something you can help them with too.
Yes. So those are the two things that I see as the most common reasons people end up leaving their home, and two preventable things. So
both are preventable, and that's the goal, is to prevent it. Is there one mistake that you see over and over again that affects mobility and injury?
people stop moving.
Okay.
They stop moving because it hurts, or they stop moving because they're stiff, or they stop moving because they say, I'm tired. I worked my whole life and I don't have to work anymore. And that's true. You did work your whole life and you do deserve a rest. But what do you want the rest of your life to look like? The reality is people are living a long time.
That's true.
And what do you want those days to look like? You don't want to live forever and be uncomfortable.
Right. You want to enjoy it.
You want to live really, really well, and then one day just maybe not wake up. But
That's exactly how I want to go, Ashley.
Yes.
Exactly how I want to go.
Yes.
That's why I keep moving, even
Yes.
if I'm tired or don't want to get up. And now all of a sudden that it's lighter earlier, the dog thinks we're up at 5 a.m.
Yes.
walking. So I'd love to maybe go at 6, but that's okay. We're still moving.
That's right.
Right?
That's
and
right.
I always feel better.
You do.
Always feel better afterwards, even if it's cold or windy,
Yes.
whatever. But it's all great stuff. So there's so much that you guys do, and you do it in the home. Does insurance pay for this?
Insurance doesn't pay for us. Insurance pays for other home care agencies, like the insurance pays for the VNA or Bayada or Gentiva. There's a ton of different home care agencies, but there's different requirements, and it's not going to be this level of service or care. They are not going to put their hands on you.
You truly are one-to-one, taking the time.
Yes.
Concierge.
Yes, yes. So we do not take insurance, and we don't take insurance because if we did, we wouldn't get to do any of the things we get to do. We would have to only do what insurance tells us we can do. And I don't want insurance to tell me what to do. I want you to tell me what to do.
Awesome. Tell me how you started this company.
I started this company driving around in my little Prius with my table in the back and my little backpack with pillows and sheets and my little bag that had some balls and bands and weights. And I would just go into someone's house and treat them. And then you end up treating their daughter, and then I end up treating their dad and their neighbor and their grandfather. And it's word of mouth. And then I couldn't keep up with it. And so then I hired a couple other PTs, and then I found out that my body was aging, going through perimenopause. So then I'm like, well, I need to help myself, right? We have to help ourselves. And
Absolutely.
so hired a menopause coach, and we work with a gynecologist now to help women get hormone replacement therapy if they want it. And young athletes who keep getting injured because they're over-specializing in sport too young. And so now we have a strength and conditioning coach. And
Wow.
so everything that has come about.
Got a great team.
Every person that has come to work with us has come organically because patients have asked for it. Like they've said, this is something I need. And I'm like, well, okay, let's figure this out. And speaking of need, we need more physical therapists. So if anyone who's listening to this knows an amazing physical therapist that is tired of doing things the way they're doing it and they want to do it differently, please send them my way because we love what we do and we want to have a great team.
And so how would somebody that wants to work for you or a family or a person needs you in their home, how would they reach you?
Yeah, the easiest way is our website, capeconciergept.com. There is, we have a contact button that you will call and you will talk to the contact button will send an email and it will direct the amazing and wonderful Justin to call you and learn about you. And he'll spend a lot of time with you and figure out who is the right therapist for you.
Okay, great. And what is your service area?
We travel from Chatham to Duxbury.
Okay.
And we also have an office here in the Pine Hills in Plymouth, which is how I met the lovely Sandra. And we have an office in Sandwich as well.
That's awesome. That's awesome. And I also know, like, you guys just did a couple of workshops. Give a little shout out about those types of workshops that you guys did.
Yes, we really believe that education is an intervention. And so the more information we can give people, the stronger they get, the more they can advocate for themselves. So we've done a ton of workshops, bladder health, postpartum mom workshops, osteoporosis workshops, learning about the different medications and how to build your bones. We just did a pickleball injury prevention workshop at the Cal in Plymouth.
Yeah, that's awesome.
We've done foot health workshops. We've done vertigo workshops. We've done TMJ workshops.
Wow.
So we love educating people because that's the ticket, right? We can teach you, we can help you, but the more that you know, the more likely you are to take care of yourselves, and you're going to live longer and better, and you're going to be able to get up and down from the ground.
Super educational. I love that. And you just gave a huge plethora of what you've been teaching. And people might not think that. So anybody listening today, it's not just physical therapy. Yeah. You hurt your leg and you're trying to recover from it. There's so much more. And I'm so glad that you were able to touch on that. I highly recommend you guys check out their website. Does it talk about all those things that you guys offer on your website? That's great. Or just call and like, hey, maybe this. Because, I mean, even me talking to you today, I've got questions for after the show. Yeah. But it's been great having you on here. There's so much more. I might have to have you back to go into one of these other topics. But I always make a key of the week. And I never know like how our conversation is going to flow, but I come up with what I think it might be. And I think this is very good for what you were saying. So this week's key of the week, your independence lives in your mobility, right? And you said, keep being mobile, keep moving. So the stronger, steadier, and more confident you are in your movement, the longer you can safely stay in your home and live the life on your terms. Start small, but start now.
I love it.
Oh, Ashley, it's been great having you here. Super eye-opening. Thank you for sharing such practical tips that people can actually start using right away. Everybody go sit on the floor. If you're thinking about your home, your future, or helping a loved one stay safe and independent, this is your reminder that little changes today can make a big difference tomorrow. And as always, if your next step involves your home, whether it's making it safer, downsizing, or exploring options, I'm here to help you guide you through it. Thanks for tuning in to Sandra Sells Tells. Be sure to like, follow, and share this episode with someone who needs to hear it. I'll see you next time.